Hello class and welcome to Chapter 7's conversation on contraception. The goal of this lecture is to cover contraceptions and to go over any of the different types of myths or any of the different types of questions that individuals have. I will do my best to answer them, but we need to start with some definitions. So first definition is birth control, and this is any type of practice in which an individual manages their fertility and tries to prevent any unwanted pregnancies. So the most common idea of birth control is the pill, but keep in mind that there's a wide variety of different types of birth controls that can be utilized. Fertility is the ability to reproduce. We will talk about how that fertility can be impeded and impacted depending on the type of birth control that is utilized. Conception is the fuse of the ovum and the sperm, which creates the fertilized egg, and that's what is the child. When it gets embedded into the uterine wall, starts to grow, starts to develop, and then 9 months later, you have a child. And then contraception, this is the prevention of that conception. All right, so you are contraceptioning that process. So you don't want that sperm to fuse with that ovum to create that embryo, the fertilized egg. And this can happen through a series of devices, different substances, or even different methods. One of the most common methods is the pull-out method, and we'll discuss that later. Today, people can choose from many different types of contraceptives, and it's really important to discuss with your significant other which form of contraceptive actually is better for you as a couple. You may have other individuals who utilize, let's say, the pill, but maybe there's a woman out there who knows that she's not going to be able to remember to take that every single day at the same exact time. So maybe there's a different form of contraceptive that would be beneficial for her and her partner to be able to utilize. Right? There are modern contraceptives that are more predictable and they are able to prevent pregnancy better. But keep in mind that despite whatever contraceptive you use, there's no surefire way to prevent any STIs or STDs. And keep in mind that nowadays we do have STIs and STDs that are not curable. So once you get it, you have it forever, and you have to go through treatments for the rest of your life to make sure that you manage outbreaks. When it comes to contraceptive use and unwanted pregnancies, there's some data that we can go based off of to see what happens with consistent use versus non-use versus inconsistent use. So as you can see, you have a pie chart here. In terms of the consistency of utilizing the contraceptive appropriately and all the time, for unwanted pregnancies, there's only about 5% of couples that utilize contraceptives consistently who actually do have unwanted pregnancies. Obviously, without use at all of contraceptives, the data shows 54% of unwanted pregnancies happen between those couples, and then with inconsistent use, you have about 41%. It's important to understand how contraceptives work, and oftentimes this is where I get many of the questions from, is because no one's actually really taught, especially in school, how the contraceptives work. So based off the physiology of reproduction, and this is how all of these contraceptives have come to be utilized, is based off the natural physiology of the male and the female. So the whole goal is to prevent the sperm from meeting the egg to create an embryo. And that's really how a lot of these work. So there's a couple different types of contraceptives that we can kind of categorize. So first is a barrier method. This acts as a physical barrier, preventing the sperm from reaching the egg. There's hormonal methods that prevent ovulation in the beginning and can kind of keep the female on track a little more, so you understand when it's safe to have intercourse and when it is not safe to have intercourse, depending on if you want to have a baby or not. There's an intrauterine device, which is a chemical or it causes hormonal changes. And we'll talk about these too, because it's very important to understand that when you're utilizing things like the pill or the implant, that you are changing your hormones. You are chemically inducing a different type of physiology, and that can take a toll on a woman's body. There is a natural method, requires avoiding intercourse at certain times or just avoiding intercourse completely. If you don't want to have a baby, there's 100% surefire way that you can make sure to not have a baby, and I think we all know what that is. There are also surgical methods as well. So in terms of getting the man or getting the woman's tubes tied or getting the man snipped, as they call it, again, all of these are created to prevent the sperm from meeting the egg. All contraceptive methods have advantages and disadvantages, so when it comes to your personal health or the health of you and your significant other, it's very important to research and think through all of the benefits plus the disadvantages that can come with contraceptive use. There are several factors that you should take into consideration. So first off, the effectiveness. Nothing's 100% guaranteed unless you just maintain abstinence completely. If you don't have sex, that's the only thing that's 100% guaranteed to make sure you don't get pregnant. But there are contraceptives that can help get you close to 100%. The convenience of it, some women cannot remember to take a pill. Some women don't want to have a device injected into them. There is the cost of it, reversibility, there's side effects and risks. And again, we'll talk about that, especially when it comes to the female physiology. There are side effects. Effectiveness is defined in terms of the contraceptive failure. So when it comes to the failure rate, it's the percentage of women that have used a particular method and have gotten an unwanted pregnancy within the first year. So again, these studies are limited to the first year. And then continuation rate is going to be the percentage of those who continue to use the specified contraceptive that they chose for a period of time. When it comes to contraceptives, there's different types. So there's reversible contraceptives and there are permanent contraceptives. An example of a reversible contraceptive would be like an implant or an IUD that a female would insert into her body depending on the device. A permanent form of contraceptive would be either the man getting snipped or having the glands in the testicles surgically resolved in order to prevent sperm from being ejaculated during intercourse, or having the woman's fallopian tubes tied, or really what it is having it snipped, again, to prevent the egg from entering the uterus, again, preventing the sperm and the egg from meeting and creating an embryo. The long-acting reversible contraceptive, or LARC, this can last for up to 7 years, and there's two different types. So there's an intrauterine device, or otherwise known as an IUD. This is a device that is inserted into the woman's vaginal canal, into the cervix, and what it does is it causes low levels of inflammation to prevent the sperm from entering through the cervix into the uterus, again, preventing the egg and the sperm from meeting. Or there are implants. This is a form of birth control, and this is implanted into the woman's non-dominant arm, and it can stay in for up to 3 years. So getting deeper into an IUD, it's a small plastic object. There are copper IUDs as well, and it releases small amounts of progesterone. There's different types of these that you can add into your contraceptive regimens, but it really just depends on you looking at the potential side effects versus the benefits and which one would actually work for you. Primarily works to prevent fertilization, again, from preventing the sperm from meeting the egg, and must be inserted and removed by a trained professional. Although, if you YouTube it, there are individuals who have been able to remove their own IUDs without seeing a physician, and really the process is simple, but you want to make sure that you do have someone trained who is able to insert and remove those for you. Here's an example of an IUD. There is a copper IUD that is being utilized, and again, you can notice the surrounding area of the vagina and the uterine wall is red, and what it is it's showing that where that IUD is inserted, and it's showing the strings that come into the vaginal canal. So that's how the trained professional is actually able to remove the IUD, and that's how some females themselves have been able to remove the IUDs by themselves, is they just tug on that string and the IUD comes sliding out. The female can feel some pressure both with insertion and removal. Also, the female can feel some pressure and discomfort while the IUD is in. So if you do happen to choose this as an option for yourself, make sure that you are paying attention to your body, and if you're starting to feel severe pain, if you're starting to see significant bleeding, then you want to go in and talk to your healthcare professional about that. Advantages of IUDs: highly reliable. Once it's inserted, and once you remove it, it's completely removed. It's simple, the convenience of it. It's very quick procedure, both insertion and removing it. Side effects are localized, but we have seen individuals and females who have experienced mood swings, they've experienced weight gain, they've experienced changes in their hormones. And remember, it is a hormone that's being released, so you are affecting your hormones. And the issue with that is that your hormones control everything in your body. They're highly involved in signaling. And so once you start throwing off your hormones, a lot of your other body functions are going to be thrown off as well. Some disadvantages: there's no protection against STIs or STDs, as with most contraceptives. The only way to protect yourself against STIs and STDs 100% is to not have any type of intercourse. Pelvic inflammatory disease can happen because, again, it's causing low levels of inflammation in the vaginal canal and in the uterus and cervix, and that's what's really preventing the sperm from meeting the egg. And keep in mind that with high levels of inflammation in the reproductive system for females, this can often lead to sterilization. So you want to ensure that you're really looking at all of the possible side effects of whatever device you decide to use to ensure that you're fully aware of what could potentially happen. Contraceptive implants are the ones that are going to be inserted into the upper arm of the woman, and these are also, similar to the IUD, going to send out a steady dose of progesterone. There's different types of brands. There's one implant, there's Nexplanon, but all of them essentially do the same thing. There's several contraceptive side effects. It can inhibit ovulation completely and affect the development of the uterine lining. Remember, the uterine lining is extremely important when it comes to pregnancy and when it comes for the female to get pregnant and that embryo to embed into that uterine lining. It thickens the cervical mucus that is right around the cervix. So if you have the vaginal canal, you have the cervix, and then you have the uterus. That cervix kind of acts as a door. And so you can think of the mucus almost as a lock on that door, and it's going to inhibit sperm movement into the uterus itself, which is where the egg actually comes in and waits for that sperm to fuse with it to create an embryo. Advantages: highly effective, but keep in mind that there are a lot of side effects that come with that. From women that I've talked to who have gotten the implant, there have been side effects such as month-long periods. I know one woman, she had a 3-month-long period with this implant. Again, there are mood swings. The disadvantage: no protection again against STIs or STDs. Only specially trained practitioners can insert or remove because there's a very small thin space that you're going to insert underneath the skin. You don't want this to embed in the muscle. And there have been some women who have experienced this device being embedded into the muscle because, remember, anything you insert in your body is a foreign object to your body. And so your body is going to see it as an enemy. It's going to try to get rid of it. And so sometimes the body will send little soldiers to try to move that item out. And so it can shift and it can migrate. And IUDs, same situation. There are a lot of cases where women's IUDs have migrated and have embedded themselves into the uterine wall. So there are some side effects that can come from this. And if you do decide to utilize any type of IUD or implant as a method of contraception, it's important to make sure that you're really listening to your body. And if you feel any sorts of pains or discomforts or anything like that, really communicate with your healthcare provider. All right, placement of the contraceptive implants. So you notice that it's going to be in the upper arm. That's the position that the woman is in. The physician or healthcare provider, whether it's a PA or physician, will go and utilize a tool to insert it right under the skin. It's almost like a really big shot. And it stays in there up until 3 years or until the woman decides to remove it. There's short-acting reversible contraceptive. For these, there's oral contraceptives such as birth control pills. There's the skin patch, and there's the vaginal rings. And with this, the user has to take action on a daily, weekly, or monthly basis in order to ensure that these reversible contraceptives are going to work. And they're called short-acting because they don't last for very long. Like the slide says, it only lasts for about a day, week, or month, depending on the use of it. Right? Oral contraceptives, or OCs, these prevent pregnancy by preventing ovulation. I'm not saying that you absolutely won't ovulate, but that's the goal, is to change up your hormones, your estrogen and progestins, and to prevent an egg from being released. Keep in mind, again, that an egg could still be released, and that's why some females will get pregnant even though they're on birth control. And it's important to understand that there are other types of medications that can counteract birth control. So if you do go in for, let's say, a general makeup or a general checkup, and your physician wants to put you on high blood pressure medication or diabetes medication, anything like that, make sure you tell them that you are on OCs, because some medications counteract and make it to where those oral contraceptives are non-effective. So you think you're taking birth control, but because of your other medication, you're increasing your chances of being pregnant because that birth control is not working. All right. There's a combination pill, so it's the most common form. You see it in the packs. Contains estrogen, progestin, and 1 week of placebo pills. And the reason for that placebo pill is to make sure that your hormones don't go completely haywire, and you're trying to keep things as steady as possible. There are newer pills offered for different types of schedules. Again, some women do not find this as a viable option for them because they cannot remember to take it at the same time every day. And this is hormone therapy, so you do need to take it at the same time each day. There's a mini pill, which is a small dose of synthetic progesterone. Again, the whole thing is to prevent the egg from meeting the sperm. Advantages of OCs: very effective in preventing pregnancy when used correctly, all right, when used per the manufacturer's discretion. Disadvantages: does not, again, protect against STIs or STDs. You have to remember to take the pill every day and preferably at the same exact time every day. A lot of females will set an alarm on their phones for this and just carry their pills with them, so no matter where they're at, they're able to take it. Typical user has about a 9% failure rate due to the fact that maybe they missed a day or they forgot to take it at 9 o'clock when they've been taking it at 9 o'clock. So there's a lot of user error that can come with this, so you need to make sure that you're the type that can utilize this effectively if you choose this as a contraceptive. There is a skin patch, so Ortho Evra is an example of this. It's a thin square patch that releases estrogen and progesterone, and it slowly releases it into the bloodstream, again, to create an effect similar to taking the oral medication or similar to the long-acting types of contraceptives. Advantages: very effective. You don't have to remember to take it each day. You just remember to change your patch. Again, does not protect against STIs or STDs. And effectiveness is similar to OC. There are a lot of women that do experience weight gain when they utilize the patch, again, because you're messing with your hormones, and your hormones regulate every other body process that you have, including metabolism and including body fat accumulation. So please keep that in mind. There's a vaginal contraceptive ring. This is a ring that is inserted into the vaginal canal, and again, it's going to play with your hormones. It's a play on hormones. So it's going to release progesterone and estrogen, and it's going to, again, prevent the sperm from meeting the egg. The advantages: 1 month of protection with no daily or weekly action required. The disadvantage is that, again, it doesn't protect against STIs or STDs, similar to the pill and the patch, but you now have a device that is in the vagina, so you need to keep in mind of watching your body for any types of pain or discomfort. If you start to notice that you're getting severe mood swings, if you start to notice that your body is not functioning how it needs to, your blood pressure starts to get affected, then you're going to have to seek medical care for that and figure out if this is something you should continue to use or not. All right, so different types of risks for contraception, pregnancy, and abortions. And next chapter, you'll hear a little more about abortions. But in terms of the different categories, the risks of death for the woman vary completely. And keep in mind that this is going to be immediate deaths within the first year. It's not going to account for the medical complications that can happen later on as the woman continues to use it. As we'll see later, and as you see with some of the other resources I've given you, there have been situations of women who have experienced severe side effects in terms of their health just going downhill because, again, you're playing with your hormones and you're playing with your body's natural method of how it's supposed to respond and how it's supposed to work. So you want to ensure that you're really researching this before you choose a contraceptive, before you choose getting pregnant, and before you choose the option for abortion, because it's very important to make sure that you're understanding fully the choice that you are looking at choosing. Depo-Provera, this is a injectable contraceptive, and this is mainly created from progestin, and it's injected every 12 weeks. And so the advantages is it is effective. It requires a little action on that part of the user because you only really have to deal with it every 12 weeks. The disadvantage: no protection against STIs. If you are afraid of injections, then this is not going to be an option for you. And you must go visit the healthcare facility every 3 months to have the injection. So while it's quick, some people don't like needles, probably not going to be the best thing for you. Also, you want to check for menstrual irregularities. Similar to the implant, there are women that have reported 2-month, 3-month long periods straight. That is obviously unhealthy because you are bleeding, you're losing iron, your reproductive system is clearly not functioning how it needs to. Decrease in bone density because of the amount of calcium that you need to keep your body up and the amount of calcium that's needed to try to deal with this type of medication. Effectiveness with perfect use, the failure rate is about 0.2%. And again, notice that it's not 100%. So you can do everything you can to try to prevent pregnancy, but it's not always 100% guaranteed. Right? 6% typical failure within the first year of use. So keep in mind that a lot of these are showing to have severe side effects when it comes to the woman's health, especially when it comes to trying to get pregnant later on. So maybe you're going through a series of years where you don't want to get pregnant at all, and then you get married and you decide that you do want to get pregnant. There are a lot of women that are having issues bouncing back and recovering from these types of contraceptives because of the damage that it can cause on the body. So keep that in mind. Right? Other types of contraceptives are male condoms. So now we're switching to what the male is able to do. This is the most common type of contraceptive that most individuals understand and have utilized. It's a thin sheath designed to cover the penis during sexual intercourse. And so the whole point of this is to prevent the sperm from even meeting the egg within the woman and the sperm from even going into the woman at all. Barrier method of contraception, it's pre-lubricated. Sometimes it contains spermicides. Keep in mind, women, that some females are allergic to spermicides, so you want to make sure you are very careful if you're using a spermicide. And a spermicide essentially is just killing the sperm. So anytime you see side, whether it's suicide or insecticide or herbicides, anything with a side, it's going to mean kill. All right, so keep that in mind. Advantages: can protect against some STIs, but not all STIs and STDs, especially when it comes to STIs and STDs like crabs, because those do live in the hair, the pubic follicles, or they do live in the hair follicles of the individual. And so while the male condom does cover part of the penis, you still have the rest of the genital area that is exposed. So you want to keep that in mind. Disadvantages: specifically for the male, it diminishes sensitivity. There are different types of male condoms that you can utilize. There's lambskin condoms, there's latex condoms. Keep in mind that some women are allergic to latex and it can irritate the vaginal canal. So before utilizing this, you do want to do your research on which option would be better for you. And the biggest thing I can say for males, please make sure it fits correctly. I know a lot of males want to go for the magnums, but some males just can't use the magnums. So please keep that in mind when you're choosing your size. All right. Most common cause of pregnancy among condom users occasionally is not using one or putting it on incorrectly. So most studies are showing that when the female puts the male condom on the male, it's more effective versus when the male puts the male condom on the male, because oftentimes it's done incorrectly and the reservoir tip is not left, and that's really what catches the sperm. If you do not leave a reservoir tip on the end after applying the male condom, then the condom can rip and the female is now exposed to the male sperm. Right? So here's just an example on how you're supposed to put it on. And if you notice in figure C, where I talked about the reservoir tip, it's going to be that little tip on the very end. Again, you need to leave that because that's what catches the sperm, and it ensures that the force of the ejaculation is not going to rip the condom and the sperm is going to stay away from the female. There are female condoms, so for those males that maybe have a disadvantage in terms of decreased sensitivity, then you can utilize a female condom. This is just another barrier method. It's inserted though into the woman's vagina. The advantages is it gives the female control over the contraceptive, and it can help with STI or STD prevention. Again, not everything, but it can help with some. Disadvantage is that a lot of people are just unfamiliar with it and they're unfamiliar with how to practice it. You do have to learn how to use it. It can be harder to find versus a male condom. You can go into any liquor store and purchase one of those. But when it comes to a female condom, you really have to find those specialized areas that carry it and that utilize it. Effectiveness is about 21% failure rate within the first year, meaning that 21% of the individuals will not utilize it correctly and that the female could get pregnant. All right, so here's an example of how to insert or how to utilize the female condom. The female condom is going to insert all the way into the vaginal canal up to the cervix. It's going to cup and cover the cervix, again, preventing from any sperm getting inside. And it's going to come and drape to the outside, and the penis would be inserted inside the condom itself. And so it's really protecting the female, it's protecting the male. But again, it can be a little more expensive just because of the amount of material that needs to be utilized, and it's not oftentimes something that is utilized by a lot of females. All right, diaphragm and spermicide. Remember, anything with side is going to mean kill. So a diaphragm is a dome-shaped cup that's made generally of rubber, and it's stretched over a metal ring. And so it's going to be inserted similar to the female condom, but the difference is that spermicide is going to be utilized with this. All right, so spermicide, again, is a lube that kills sperm. It has a chemical in it that kills off sperm. It must be left in place for 6 hours following intercourse to make sure the spermicide has enough time to kill all the sperm that's in there. Remember from your textbook, sperm can live up to 72 hours, if not some days. So you want to make sure that the spermicide is having its amount of time to be able to be effective. Advantages: is less intrusive than a male condom. Disadvantages: it must be used again with the spermicide, and there is risk of what's called TSS, or toxic shock syndrome. So some females may have heard this from utilizing tampons and leaving them in too long. Anytime you insert anything foreign into the vaginal canal, you do have a risk of toxic shock syndrome because it is a foreign object, and you never know what types of chemicals that they're putting on the tampons or what kind of chemicals are actually in that product that you're using. So please be extremely careful if you decide to utilize something like this, and really research and find out what's inside that item or what is inside of that product so you can keep yourself safe. All right, so here's an example of utilizing a diaphragm. So what it's going to do, you're going to inject the spermicide, you're going to fold it. Again, it is rubber on a metal ring, so you can fold it, insert it into the vagina via the fingers, and you're going to insert all the way up to the cervix, and it's going to cup over the cervix, and it's going to block the cervix. So again, it's allowing increased sensitivity for the male because essentially you're not utilizing a condom, but the female still has something in place to protect herself just in case ejaculation does happen inside the vaginal canal and the sperm do head up to the cervix. There is not only a diaphragm cup covering the cervix, preventing the sperm from entering the uterus, but there's also spermicide to make sure it's killing any of the sperm that do happen to make it past the cup. All right, there's a cervical cap that the female can also utilize. It's another barrier device. It's used similar to the diaphragm, but it's a little smaller, it's a little more flexible, and it fits very snug over the cervix. So if you notice from the last slide that the diaphragm is a little larger, this cup is going to be smaller, and it's going to fit specifically right over the cervix. All right, it's fitted by a trained physician because it is smaller and you don't want it to migrate up into the uterus because now you have a foreign object in your uterus and that can cause severe medical issues. Advantages: may be left in place for up to 48 hours. Disadvantages is the difficult of insertion and removal because it is small and it fits so tightly over the cervix. There is a 16% failure rate within women who have never had a child. There's a 32% failure rate in women who have had a child. So keep in mind, again, none of these are 100%. If you're looking for a 100% guaranteed way of not getting pregnant or not getting someone pregnant, then you just don't do anything at all. There's also Contraceptive Sponge. So with this sponge, it's a round absorbent device. It's about 2 inches in diameter, and it's pre-saturated with spermicide. So similar to the diaphragm, you're going to apply spermicide to this. So again, it's going to insert into the woman, and it's going to make it to where if sperm does happen to reach up to the cervix, that spermicide is going to kill it. Again, not 100% effective. So there's about a 12% failure rate in the first year, and about 24% of women who have had a child have gotten pregnant even while they were utilizing this. Keep in mind, it is utilizing spermicide, so TSS is a possibility. There are vaginal spermicides. There are foams, creams, jellies, suppositories, films that the female can insert into the vaginal canal. Again, there is a risk for TSS because you are using a spermicide. There's about a 28% failure rate in individuals that utilize this, but with vaginal spermicides, you can utilize this in combination with any other barrier method that you find useful. So if you find that the male condom is beneficial, but you want a little extra protection, you can utilize vaginal spermicides with that. All right, here's an example of how the female would insert the vaginal spermicide. Again, the closer it can get to the cervix, the more effective it's going to be. This oftentimes is where the success rate comes in, or the failure rate comes in, because if the woman does not get it close enough to the cervix, some sperm could actually survive through the spermicide and make it to the cervix and enter into the uterus where the egg is waiting. and the female could get pregnant. So it's important to ensure that if you're utilizing something like this, the application is done absolutely correct, or else you could see an increase in failure rate. Right, abstinence. This is the avoidance of sexual intercourse at all, based on many factors. So no contraceptive measures are available. There's concern over the side effects of the different contraceptives. There's cultural or religious beliefs that come into play, or there's personal values. So there's different reasons as to why an individual or a couple may choose abstinence. And again, if there's any method that is 100% guaranteed, abstinence is the only one that's 100% guaranteed to ensure that you're not going to get pregnant, you're not going to get anyone else pregnant, and you're not going to contract an STD or an STI. Fertility awareness based methods. So there's different types of methods that the female can utilize that are a little more natural. And a lot of females are starting to turn towards this because of the negative side effects that they've seen, not only while utilizing contraceptives, but also after quitting use of contraceptives, because of the way it changes the hormones, the way it changes how the body functions, the way it can create sterilization or the inability to get pregnant after discontinuing use of those contraceptives. So a lot of females are actually utilizing calendars. They're utilizing basal metabolic temperature, which is where you take your temperature first thing in the morning and you track your temperature, and it'll show you when you're more likely to conceive versus when you're not more likely to conceive. And there's mucus-based methods where you check the thickening of the mucus lining on the cervix to see, am I more likely to get pregnant right now? If you are, then you utilize abstinence, or you utilize a contraceptive barrier method. If you're not likely to get pregnant, then it just means that you're less likely to conceive, but it doesn't, again, mean it's 100% you're not going to conceive, just because you're not extremely fertile at that point. So it's really just the woman learning her body and learning the fertility awareness of her body. And I like this method because it really allows the woman to connect with herself and what her body is doing, and really allows the woman to get to know her body, and it allows her partner to also get to know her body as well, so they can understand this is why she's having mood swings, this is why she has increased eating. Because when it comes to a woman, the cycle happens throughout the month, so it's always changing. So our hormones are consistently changing, and that means our moods can change, our feelings can change, our behaviors can change. All right, combining different methods. Couples can combine methods in a variety of ways. You can add STI protection. You can increase contraceptive effectiveness by learning how to utilize them effectively, or learning how to utilize them better. There's added benefits, especially for women, typically outweighing the extra effort and expense. So combining different methods could be helpful in terms of increasing your chances of being able to not get pregnant. All right, here's different contraceptive methods and STI protection. So again, this is kind of just everything we talked about in a chart. We didn't talk about sterilization too much. It doesn't protect against STIs, but it does absolutely protect against getting pregnant, because you're doing something that makes it to where your reproductive system will not work, right? It's not going to release an egg, or it's not going to release sperm. This is where the man gets snipped or the woman gets her tubes tied. Not completely 100% guaranteed, though. There are stories of women that have gotten their tubes tied, but the egg was still able to jump over that gap and was still able to get to the uterus, the sperm was still able to meet the egg, and the woman was still able to get pregnant. Again, if you want a 100% surefire way of not getting pregnant, not getting an STD or an STI, abstinence is going to be your method. All right, there are emergency contraceptives, or EDs. This is referred to as postcoital or post-intercourse methods. After an individual has had unprotected sex. And the most common one is Plan B. Although you can now get Plan B without a prescription, keep in mind that it's very harsh on the body, and depending on the stage of conception that the woman is at, it could essentially recreate a forced miscarriage or forced abortion. All right. There are individuals that state is not an abortifacient, doesn't interrupt the establishment of pregnancy, but again, it's dependent on when that's taken. It is very harsh, and women have reported experiencing vomiting, experience severe hot flashes, and experiencing severe flu-like symptoms while taking it. IUDs can also be used as emergency contraceptive, again, because it increases inflammation in the vaginal canal, and it kind of interrupts that process of conception. Permanent contraceptive is sterilizations. If you plan on getting pregnant or having a baby later on, this is not a method for you because this is absolutely permanent. Again, there are some situations where an individual has been able to still get pregnant or get someone pregnant, but those are few and far between. When it comes to male sterilization, it's often, most times, more preferred over the female sterilization because, one, the cost is less. The complexity of the surgery, it's not as invasive as with the female. The male, they're able to access the needed parts in the genitals from the outside. For the female, they do have to go internal, so it is a more complicated surgery. Likelihood of complications and likelihood of regret are less when a male is sterilized versus when a female is sterilized. So male sterilization, this is known as a vasectomy. This involves the surgical severing of the vasa deferentia, which is the duct that carries the sperm to the penis, essentially. So if that tube is cut off, then there's no sperm going to the penis. The male is actually able to perform exactly how they were prior. It's just that no sperm is going to be ejaculated. A fluid will be ejaculated, but it's not going to contain sperm. All right. Effectiveness, overall failure rate is about 0.15%. So it's really low, but again, not guaranteed. None of these are absolutely 100% guaranteed. And the reversal cost for a vasectomy is about 50%, it can be costly, and the success of that reversal is about 50% effective. All right, so here's an example of what happens. Again, they are surgically able to create an incision on the external genitalia, and they are able to reach the vas deferens, go ahead and create a cut, and tie them off. So for female sterilization, this is going to be laparoscopy, or it's going to be tubal sterilization, which really means the fallopian tubes are sealed off or tied. So keep in mind that the ovaries carry the eggs, the fallopian tube is kind of the highway to the uterus, and the uterus is where the egg can be fertilized and can be embedded as an embryo. There's about a 0.5% failure rate for this, again, because it's not absolute, right? So there are examples of the tissues healing where the fallopian tubes healed back together and still created a way for the egg to enter into the uterus. There's examples of the egg jumping over that gap that was created during surgery, and the egg was still able to be fertilized. So not 100%, but it is a form of female sterilization that can be utilized as a permanent method. All right, here's an example of what happens. So there is a cut. Sometimes it is tied off. Again, remember I talked about that egg jumping that gap or that tissue healing back together. The body likes to remain in balance, and anytime you perform a surgery like this, you are throwing the body out of balance. So you need to keep in mind that the body is going to do what it can to make sure that the reproductive system can still be utilized. So sometimes it does create healing, and that egg can still get into the uterus. All right, when it comes to a hysterectomy, this is the full removal of the uterus. If you don't have a uterus, then there's no place for the baby to grow, and therefore you will have no baby. All right, this is not reversible though, so keep that in mind. Once you do remove your uterus, once you do have a hysterectomy, you cannot reverse it. Because of the risk, it's not recommended, especially if you have a healthy reproductive system. Other forms of contraceptives are less risky. So normally the physician is going to recommend a different form of contraceptive or female sterilization versus removing the entirety of the uterus. Keep in mind that the uterus is a part of the female reproductive system. It is involved in hormones. And so if you do remove the uterus, you are messing with your hormonal levels. Issues in contraceptions. When it's okay to begin having sexual relations, there are a wide range of options. All right, keep in mind that you need to make sure that you are absolutely prepared for that percentage of chance that these could fail. All right, and if your contraceptive does fail, are you emotionally, financially, and mentally able to handle the consequence of having a baby from your decisions? So please keep that in mind. And when it comes to contraception and gender differences, again, there's some forms for men, there's some forms for women. There are some that can prevent STIs or STDs, but it's the responsibility of both the man and the woman to make sure that they're utilizing the correct one for them, and they're utilizing one that is not going to cause a lot of physical, emotional, or mental side effects. All right, when it comes to education for teenagers, sex education is important in terms of understanding what you're getting yourself into. And so while media may kind of Hollywoodize this whole idea of having sex, keep in mind that We do have mental health, we do have emotional health and physical health, and all of those are connected. And anytime you are intimate with an individual, you are absolutely connecting on more ways than just physical, whether you're trying to or not. So there are abstinence-only school programs. Doesn't mean it reduces the number of teens having sex and doesn't reduce the number of teens getting pregnant. What really needs to be told is the different forms of contraceptives, but the reality of it is if you absolutely do not want to have a baby 100%, or you don't want to get an STI 100% or STD 100%, abstinence really is the only way to make sure that 100% of the time won't happen. But it's important to make sure that we understand the different other options that are available. I always recommend to students, just make sure you do a mental, emotional, and financial check of yourself, because if you're not financially, emotionally, or mentally in the position to essentially give your life up for another human being, because that's essentially what you do when you become pregnant and you have a baby. Your life is no longer just yours. You now are taking on the responsibility of raising another individual to be a good citizen in society. So keep that in mind and do that check. If you're not ready for that, abstinence may be your option. So looking at which contraceptive method is right for you. There are different things to consider. So biggest ones would be the implication of unplanned pregnancy and the efficacy of the method. You want to make sure you're looking at the health risk. You're looking at the possible risk of contracting any type of disease, STD, STI, convenience and comfort level, the type of relationship that you have with the individual. Some individuals can look at the cost of it, religious and philosophical beliefs, and potential non-contraceptive benefits. So there's a lot of different points that you want to make sure that you're looking at when you're looking at forms of contraceptives, and really be honest with yourself on which ones you're willing to accept the risk for and which ones you're not. Right? Here's just a quick review of everything that we went over. So we talked about how contraceptives work. So at this point, you should understand how the different types of contraceptives work, including the long-acting reversible and the short-acting reversible. The long-acting, again, is going to be like the implant or the IUD, something that you leave in for an extended period of time, up to years. Short-acting are going to be those reversible ones, such as utilizing the pill, utilizing any other type of short-acting contraceptive. Explaining approach to emergency contraception. So if you do find yourself in a compromising position and you're not sure if you could have gotten pregnant, again, going over things like Plan B to be able to utilize, let's say, an IUD to create that emergency contraceptive. Different types of permanent contraceptives. We talked about male sterilization and female sterilization and how that can happen. We also talked about the different educational issues in terms of contraceptive and where abstinence-only programs have not really worked too well to decrease the amount of teenagers having sex or getting pregnant. And we talked about how to choose the right contraceptive method that is right for you. So make sure that if you needed to go back over any of this, go ahead and go back over any of the sections you need to, and let me know if you have any questions.